Hello, I am Mantastic and Fantastic, and today I'm coming with a status health update as I've been somewhat missing for a while, and the sunglasses are not just because I want to be trendy or chic or hip to the hop, but because my eye is very sensitive still. It's almost fully dilated like 2 days later, and I just want to kind of just summarize what's happened in the past few days, as it's been kind of a roller coaster of just emotions and physical changes, I should say. So Wednesday evening, I made that post on my site with a video just explaining my health situation, and I realized that there were a bunch of comments coming in, but I was late at night because my surgery was scheduled early the next morning, so I didn't really have a chance to look at them. And then on the day of the surgery, they called me in to come in an hour earlier, so I had even less time to get ready, so I couldn't look. But I know that there have been a lot of support and comments as well as monetary contributions, and Pancake, who's to the right of me, has read some of them out to me, like just the comments people have left, and it's very moving and heartwarming to know that I have a community that is so supportive. So going back to my recap of what happened, so I go to the hospital, and then once I'm there, they tell me, oh, we're not early anymore. We're on time again. So I arrived basically an hour early for no reason, but you can't have cell service when you're in that the prep area, I guess what it's called. So while they're prepping me, basically I get lots of different eye drops, people like looking in my eye basically quite a bit, and they stick an IV into my hand, so I have an IV drip, which will eventually administer various drugs and anesthetics, so I pass out. And it was kind of awkward going to the washroom. Like, I was dressed in like their full hospital outfit. There's no clothing underneath, so it was like blowing. I wasn't blowing in the wind, but it wasn't that fashionable. But I had like a head cap and everything, so I was walking around to go to the washroom signs with like my IV pole hunched over because my back and neck were hurting, and I couldn't see because my eyes were being treated. So I must have looked really silly walking around. But eventually, I think I went to the washroom a few times and going back and forth, and then the surgeon came by a bit before my admitting time, and just like kind of reiterating what's going to happen, and like just asking which eye are we doing. Just I think that they wanted to be super careful, which they know, of course. And I say my right eye, and then she pulls out a pen from her pocket and just draws on my forehead, and I had no idea what she wrote, and I was like, huh? It was unexpected, but she's just marking that it's the right eye because I guess for legality purposes they want to make sure when the patient's knocked unconscious that they have at least some confirmation that it is the correct limb or eye, whatever they're operating on. So eventually I get wheeled into the operating room. It kind of felt like I was almost in a movie, like going down like various long hallways, people like getting out of the way because I'm on the big hospital bed and whatnot. And I get pushed into the operating room. It wasn't as white as I thought. It was kind of beige-like. I'm not sure why. Maybe my eyes were being dilated at that point too much, but regardless, it was kind of like beige-like, and there was the surgeon, a couple nurses, and an anesthesiologist. And then I moved me onto like the operating table, and then the anesthesiologist tells me that we're going to put the drugs into your IV drip, so it'll go into your bloodstream shortly. And here's like a special oxygen mask, and just take some deep breaths. And I took deep breaths, and that's all I remembered. And then I woke up a couple hours later, I believe, in the anesthesiology recovery room. Basically, I think it's a room where they take all the people who've been put under general anesthesia to recover from. And it was probably the best sleep I've ever had. I don't remember anything, but it really sucks until you wake. It's great until you wake up, because when you wake up, it hurts and you're disoriented, and everything was really bright. I had like a special metal eye patch on and everything as well on my right eye, but my left eye was very sensitive. Like, I think because both eyes are somewhat connected and try and work in tandem, that my left eye was being infected even though it didn't have necessarily treatment done to it. So everything was really bright. My right eye hurt a lot, and I basically just had like a towel draped over my head because it was so bright. And I must have looked really silly. I was just like lying in a bed with a towel over my head. Some nurses walked by asking what's wrong with him. I don't remember too much. I was really groggy. So spend probably like half an hour, 45 minutes there, and then go back to the regular recovery room, I guess, where your family can see you and whatnot. And like, I've never had general anesthesia before, and it's very disorienting. Like, I feel really groggy. My whole body felt like the Michelin Man. Like, I was wrapped in a bunch of like pillows, walking around like fuzzy, like marshmallow clouds. Well, wasn't that happy. It was like just fuzzy and groggy. And there was a lot of nausea and dizziness. I think partially because my eye was affected. That vision is used a lot to stabilize yourself, and because that was such greatly impacted, I had a lot of nausea and dizziness. Like, it was really disorienting. Like, I think I almost passed out at one point, like just keeling over, like when I had to stand up to go to the washroom again. So it's not a fun thing to go under. I think I'm quite a sensitive guy, not just emotionally, but physically. Like, treatments in general, like, I take a while to recover from. Like, I remember before when my eyes would be dilated, it would take sometimes 2 days for it to normalize. And I think it's still the case right now. Like, my eye was, eventually they took off the eye patch the next day. My eye was like fully dilated still. Like, that was about 12, 16 hours later. And it's still almost fully dilated. And this is Saturday around noon, I think. So it's almost been 2 days and it's almost fully dilated still. So going back to my story, I jump around a bit. I get discharged from the hospital several hours later, once most of the nausea and dizziness went down. There's still pain involved. Like, they gave me Gravol, they gave me Tylenol 3. Tylenol 3 is just a bit stronger Tylenol with codeine in it. Helps for my eye, I guess, a bit. Gravol's for nausea and upset stomach because I was having that. Eventually I get discharged home, which is nice because I'd much rather be at home because I'm more comfortable. I basically like just went into my bed and made a pillow fort. Like, you had to be kind of kept upright afterwards because your eye, like, the pressure is better if you're upright. So, like, inclined, lots of pillows. Felt like a little kid in a pillow fort. It was kind of nice in that way, but I couldn't see much anyways. So, just on Thursday evening, which is the day of the surgery, when I was at home recovering, Pancake would be like reading out comments to me of like people said, and, like, it's really heartwarming and moving. Like, I know, like I said before, that the Puzzle and Dragons community is one of the better communities out there, but it's still like unexpected to see like that much support, like that many people care, like people take the time out of there to at least comment something, like whether it just be like a get well soon or an anecdotal story about themselves and like their own health struggles and how they overcome it. And it's moving because I didn't expect that, because I don't even share this with my like real life friends on Facebook because like I feel such disconnection from that. But in the Puzzle and Dragons community, I feel a much stronger connection. So Thursday evening rolls by, just groggy, dizzy, pain, whatnot. And then Friday morning, I'm meeting with the surgeon as a follow-up. So I go meet the surgeon in her office, and they take off the eye patch, and my eye is like almost full blood red. Like they ruptured a bunch of blood vessels during the procedure, and like it looks really scary. Like I look like a terrifying zombie with fully dilated pupils. So she's discussing what happened, and it didn't go according to plan. Not in a bad way necessarily, but what happened was, because the lump is very small and it's inside my eye in a hard to reach area, they had difficulty pinpointing the exact location of where the lump is. Because it's small and it's in your eye, and it's, even with ultrasound, it's still hard to know for certain. And the surgeon did not want to go through with the full procedure. Like, they made some various cuts and incisions already, but not piercing through the eyeball, like the tissue around to like move the eyeball into position, because they have to get at it appropriately. So that's what's causing the pain and the rupturing of blood vessels. But they didn't do the eye wall resection because she couldn't, without 100% confidence, know exactly where the lump is. Because this is not something you want to like doing trial and error with. You don't want to be cutting through the eyeball and missing by like a margin and having to recompensate, or piercing through the lump itself and popping it, if that's appropriate term, popping it. But she couldn't know for 100% certainty where it was, so they didn't do the eye wall resection. So she told me that in a way that's kind of a good thing, because I didn't have like the most invasive surgery possible and no extra risks were taken. Of course, there's still risk of infection, other damage as well through the other things leading up to that part, but because she said it's so small, there's a lower chance it's malignant, but of course there's still a chance because they can't know for sure because they can't access it. So in 6 weeks' time, I basically go do more tests, and I just probably have to be monitored for the rest of my life unless it grows enough or they can locate it better and they operate and take it out. So nothing got accomplished except it's just delaying the problem or delaying the inevitable. Like, it's still in my eye. I'm still worried all the time. Like, nothing happened. Like, I went through, to a certain extent, unnecessary pain and discomfort for no reason because they couldn't fully operate because they couldn't know where it was for certain. So, like, it's frustrating because I don't know what's going to happen. Like, basically 6 weeks I go back, and not necessarily for surgery, but like all the other tests, like more ultrasounds, more scans and whatnot, but nothing happened. So it's frustrating, like going through all this, like this emotional roller coaster when it technically could have been avoided, maybe. But like the problem is still there, it's still real, but it's just kind of being pushed a bit back 6 weeks, if you may. And then in, I guess, news for other health issues, like I mentioned, I have lots of neck and back problems. That's why I have this pink pillow, actually. It helps keep my neck in a good position. That's why I don't know if you'll notice when I stream or record videos, I have this pillow, and it's used for that reason. But I got a call from like Vancouver General Hospital. It's the main hospital in Vancouver, one of the two main hospitals, and from the radiology department that I have a procedure for my back scheduled in May. I'm put on the cancellation list, so I have been on cancellation list before, and I do get bumped up sometimes, so it could be sooner, but it's going to be at least, it sounds like a modestly large procedure where they're going to be administering various nerve blocks into my spine, and it's more significant than the other ones I've had thus far. Like I said, it might take an hour or 90 minutes to do, so it sounds like it's going to be a modestly large procedure. They didn't give me many details, I think mainly because it's so far away. I have to see my doctors and whatnot. I guess maybe they'll fill me in more. But that's kind of where I'm at. Like, I'm just waiting the 6 weeks to get my eye checked again. And then obviously continuing my other treatments, which are painful to say the least. And then next May or earlier is that special back procedure. So I'm definitely not out of the woods yet. I still have basically all the same problems as I did before with just extra discomfort in my eye. Like, I had to take like 10 stinging drops every day. It's not fun, and I still can't see very well. Like, I want to reply to comments. Like, it's just challenging. Like, I think maybe a day or two more, and my eye will settle down enough to be able to read properly. Like, screens are a little hard to read. I can look at them here and there. Like, I played a bit of pad, but by playing I mean buttoning and having Pancake help me. Like, I just button through things like Lube, Australis. Like, I'm not actually knowing what's happening. I just know that if I do the buttons in the right order, I kill the floor. So that's kind of where I'm at right now. I just want to give an update. Like, I can't write this out or type it out, so I'm doing it orally because it's something I can still do is talk. But I just want to say thank you to everyone and for all your support, whether it be like on my Facebook page, the YouTube comments, my site itself, or even Reddit. I was drawn to my attention that like someone posted my health status on Reddit, and there have been a lot of support there as well. So I just want to say thank you to everyone for being supportive during like this really challenging time. Like, I wish I had better news, but I unfortunately don't. Like, I don't know what's going to happen still. Like, it's just uncertain. So I do appreciate everything that everyone's done, like whether it be just like giving like keeping me in your prayers, your thoughts, kind words, or even the monetary donations. Like, all of it adds up. It all makes a big difference, and I do plan to reply to each and every one of you when I am able to, of course. Like, I'm assuming maybe Monday, perhaps, I might be able to do things more functionally, but for now, it's been a lot of, like, napping, sleeping, just, I still have a bit of the general anesthesia, like, grogginess. Like, I think I take a long time to recover in general, unfortunately, but it's a little hard to see. Like, sometimes I can look at screens for a bit, but it's a little challenging still. But I do appreciate what everyone has done in the community for me. Like, it means a lot. So hopefully this maybe answers some questions. Like, I do want to try and keep you updated because, like, I feel like it is important. I don't know, I'm rambling. But regardless, I do appreciate it. Thank you for all your support. Hopefully I get back into the swing of things soon. I'm hoping Monday things are a bit more normalized by that point. So thank you for watching, and happy puzzling. Oh, where's this recording?